Hi guys, I'm Dr. Nirmal. Welcome to my channel Doc Talk. Hi guys, so welcome back to my channel. So today we'll be discussing again another topic of important topic series, which is pediatrics. So let's start with pediatrics. Now in pediatrics there are so many topics that you should know, but there are a few topics that you should must know thoroughly. Okay, because pediatrics से ज़्यादा क्वेश्चन नहीं पूछे जाते. सो जो पूछे जाएंगे अगर वो भी नहीं आते होंगे तो क्या फ़ायदा पढ़ने का पीडियाट्रिक्स को. तो पीडियाट्रिक्स के कुछ टॉपिक्स हैं जो अच्छे से कर लेने चाहिए, ताकि जो हर साल रिपीट होते हैं क्वेश्चंस, ऐसे टॉपिक्स हैं पीडियाट्रिक्स में आते हैं. सो लेट्स स्टार्ट विद पीडियाट्रिक्स टॉपिक्स. नाउ द वेरी फर्स्ट वन इज माइलस्टोन. नाउ अब कई लोगों को लगा कि माइलस्टोन में क्या इंपॉर्टेंट है. ओके, सो यही तो चीज़ है कि माइलस्टोन में कुछ इंपॉर्टेंट लगता नहीं है, क्योंकि इट्स लाइक टोटल रट्टा. ओके, यू हैव टू रट्टा कि कब क्या होगा. एंड अगर तुमसे पूछ लिया जाए कोई इमेज देके कि लाइक फॉर एग्जांपल अगर इमेज आ जाए, अ टोडलर इज going upstairs with one step at a time, and they will ask you for the age of the toddler, how will you tell? Okay, just because they have given only the image, nothing else, just image and written what is the age of the child here. So उसके लिए you should know the milestones. और अगर एक बच्चा वहाँ पे बैठ के ब्रिज बना रहा है तो you should know कि किस एज पे one can make a bridge. Okay, और अगर कोई सर्कल ड्रॉ कर रहा है तो at which age one child can make a circle. That's why milestone is like a must to do topic. Okay, then you should know about statures, proportionate, disproportionate statures. Okay, and the causes which are causing the proportionate and disproportionate stature differences, short stature basically. ओके, सो यू शुड नो दिस. लॉन्ग स्टेचर की इतनी दिक्कत नहीं है, बट शॉर्ट स्टेचर को अच्छे से पता होना चाहिए. डिस्प्रोपोर्शनेट बिटवीन प्रोपोर्शनेट एंड द कॉजेज बिटवीन डिस्प्रोपोर्शनेट एंड प्रोपोर्शनेट स्टेचर्स. ओके, एंड उसमें भी अब प्रोपोर्शनेट और डिस्प्रोपोर्शनेट में भी आगे दो टाइप का होगा, जिसमें अपर मोर देन लोअर सेगमेंट एंड लोअर सेगमेंट इज मोर देन अपर सेगमेंट. सो बेसिकली स्टेचर, शॉर्ट स्टेचर इज अ वेरी इंपॉर्टेंट टॉपिक. Then if we are talking about pediatrics, the neonatal topics are must. So we should know reflexes, jaundice, sepsis as well as resuscitation. Now jaundice maybe we should know the cutoff values for doing a phototherapy. Okay, and then we should know the reflexes which are after क्या बोलते हैं birth, and okay, which are before birth, then when they appear, when they disappear, these kind of things, and in which diseases they reappear after being lost. Okay, in the childhood. Okay, so these kind of things we should know about neonatal reflexes. And resuscitation is like a proper schedule. Okay, a procedure, step by step we should know at what step what we can do. Okay, during resuscitation. Then comes the hypoxic, ischemic, encephalopathy. Now this is one of the most important topics. We should know the types and the stages of hypoxic in ischemic encephalopathy. Then comes the congenital heart diseases. Now in congenital heart diseases we should know what are the types of x-rays. Okay, if we are seeing agonocyte, or we are seeing okay boot shaped heart, or if we are seeing snowman heart. Okay, now these are few characteristic x-rays which are associated with some congenital heart diseases that we should know. Then we should know about seizures and epilepsies. Then we should know a difference between nephrotic as well as nephritic syndrome here in the children's. Okay, then we should know a very important topic, that we should know a difference between kwashiorkor and marasmus. Okay, now these are two types of malnutritions. Okay, we should know about these. Then comes the celiac diseases, which is again a malabsorption disease. Then we should know about dehydration. Now dehydration is a very important topic. We should know about types of dehydration A, B, C, and the management given to type A, B, C. Now okay, now which in type A we will give home based management, in type B and C we will give hospital based management. Okay, so we should know about dehydration and how to classify it into A, B, C dehydration. We should know all the features also. Then comes the laryngomalacia, which is a known thing. Okay, ये pediatrics में भी आती है और ये ENT में भी आती है. Then comes croup and bronchiolitis. This is again repeated topics which can be seen in ENT as well as respiratory medicine as well as in pediatrics. Then comes the cystic fibrosis. Now cystic fibrosis के associated diseases, what are the most common features, what is the first feature to diagnose cystic fibrosis, what are the genes which are affected in cystic fibrosis, what is the protein which is affected in cystic fibrosis, how to diagnose cystic fibrosis. ये सब चीजें पता होना चाहिए cystic fibrosis के बारे में. Okay, then TB management in child or other infections like measles, chickenpox, mumps, rubella, pneumonia, and pneumonia maybe we have different types of home-based as well as hospital-based management. So we should know about all of these infections in children is very very important. Okay, then comes the sexual maturation rate SMR different in females and males. We should know about these. In पहले क्या आता है, थिलाकी आती है कि बाकी चीजें पहले आती हैं, और बॉयज में पहले क्या आता है, ये सब चीजें पता होनी चाहिए. Then comes the inborn error of metabolism. Now this is an aspect which is also common with biochemistry. Okay, so ये चीजें पता होना चाहिए. Inborn error of metabolism. Different types of errors occur in childhood or congenital inborn errors which is seen in the children, and what are the clinical features by which we can diagnose them. Then we should know about meningitis, different causes of meningitis. There are different causes in neonates and different in infants or the children, basically school going children I'm saying. Okay, then we should know about respiratory distress syndrome, how it happened, how we can treat it. Then we should know about necrotizing enterocolitis, different stages of necrotizing enterocolitis and how to diagnose different stages, and at which stage which treatment should be given. Okay, now necrotizing enterocolitis is a very important topic here. Then we should know about perinatal asphyxia. Now if we say कि इतना ही पेडियाट्रिक्स में करना है, तो नहीं, इतना नहीं करना है, और भी बहुत सारे टॉपिक्स है जो करने हैं, पर ये जो टॉपिक्स मैंने बताए हैं इनको बहुत अच्छे से करना है. ओके, इनमें ऐसा नहीं करना है कि हाँ नहीं याद आ रहा तो कोई बात नहीं, नहीं समझ आ रहा, इनको अच्छे से करना है. और इन टॉपिक्स में भी जो मैंने येलो से मार्क करे हैं, जैसे नेक्रोटाइजिंग एंटेरोकोलाइटिस, रेस्पिरेटरी डिस्ट्रेस सिंड्रोम, मेनिंजाइटिस, इनबॉर्न एरर ऑफ मेटाबॉलिज्म, निमोनिया, मीजल्स, cystic fibrosis, dehydration, kwashiorkor versus marasmus, congenital heart disease, hypoxic ischemic encephalopathy, milestone neonates as well as short stature. इन टॉपिक्स को तो और अच्छे से करना है. तो बेसिकली जैसे बोलते हैं ना, घोटा लगाओ और पी जाओ, वैसा वाला काम करना है, अच्छे से करने हैं ये टॉपिक्स. भी पेडियाट्रिक्स से कम टॉपिक्स पूछे जाते हैं, और अगर कम टॉपिक्स पूछे जाते हैं तो तुम्हें वो आने चाहिए. ओके, सो सिलेबस काफ़ी कम रहता है पेडियाट्रिक्स का. सो ये वो सारे टॉपिक्स है जो हमें अच्छे से आने चाहिए. इसके अलावा भी पेडियाट्रिक्स के लिए बहुत कुछ आना चाहिए, पर ये दीज टॉपिक्स आर मस्ट टू डू टॉपिक्स. ओके, आई गेस दैट्स ऑल. थैंक यू.